Now to a major development in the fight against COVID-19. The youngest group of people, kids as young as 6 months old, could soon be getting their COVID vaccines. Today, the FDA recommended emergency use authorization of the vaccine for kids between 6 months and 5 years old. Fox 12's Anna KATAYAMA joins us now live with much more on these developments. Anna?
Bonnie, there are a couple more approvals that we're still waiting on. The CDC and the Western States Scientific Safety Review Work Group both need to sign off, but all of that's expected to happen this weekend. So by Monday or Tuesday of next week, parents should be able to bring their kids to clinics like this one to get their vaccine.
Here. Oh, God. Oh, God. No. Nice deep breaths.
As a physician, I have to say that the impact of viruses on young children really has been downplayed.
Doctors say we're turning a page in our fight against COVID-19. Some of their youngest patients will soon likely be eligible for a vaccine.
There's a lot of unexpected things that happen to kids that land them in the hospital, and COVID shouldn't be one of them. So if there's any way that we can reduce the uncertainty of things happening to our children, they should partake of that protection.
We don't hear much about the effects of COVID-19 on the very young. But nationwide, 500 kids have died from COVID infection, and 8 of those kids are from Oregon.
Severe disease can occur in children even if they don't have much of a medical history or underlying medical condition. And once they become infected, children, as we know, can have short and long-term effects.
As soon as next week, the Pfizer vaccine will be available to kids 6 months to 4 years old, and the Moderna vaccine available to kids 6 months to 5 years old. Both vaccines provide similar protection, but the Pfizer vaccine will require 3 doses, the Moderna vaccine just 2.
Each dose of Moderna has a higher amount of the active ingredient, shall we say, the mRNA, and it packs a little more of a punch. And so Moderna, we know, is a hotter vaccine.
Dr. Nolt says that means Moderna may produce more side effects, such as mild fever or mild injection site pain.
Can we take a deep breath? That was the job. Yep. And you're done.
Doctors say both vaccines are the best way to prevent serious COVID disease in your kid.
I would urge people to get their children vaccinated so they can remove one uncertainty from their child's life.
And back live now. Another point that doctors are making as far as protection is that masking often doesn't work for this very young group of kids because they don't keep their masks on. And also, if a kid gets seriously ill with COVID, a lot of the treatment options that we have are not approved for kids, so they're only approved for adults. So the treatment options for kids are limited. We're live in Hillsboro tonight. Anna KATAYAMA, Fox 12 Oregon.